expecting a few more, but we will just go ahead and get started. I'd like to welcome you here to Adagio Health today. I'm Karen Verostek, and I'm the Director of Nutrition Services here at Adagio Health. And we're going to try to provide you with a lot of information about our internship and about our organization. And then we're going to give you an opportunity to ask questions of me in front of the group, and then you'll have an opportunity to ask questions of our current interns. All the things that you don't want to ask me, but you want to ask them. So, but before we get started with the formal part of our presentation, I'm going to ask our interns to introduce themselves and tell you a little bit about where they're from, and also an interesting fact about their internship experience thus far.
Hello, my name is Natalie. I'm from Natrona Heights, so this lovely town. I went to IUP, and a fun fact about my internship experience thus far is during my WIC rotation, I lived with my brother in Slippery Rock and slept on a couch for 5 weeks.
My name is Jess. I am from Williamsport, Pennsylvania, and I went to Pitt. My fun fact is that I got a diabetes insulin pump put in my arm.
I'm Emily. I'm from Lewisburg, West Virginia. I went to West Virginia University. And fun fact about my experience as far as I actually got married during the internship. So that was crazy.
Hi, my name is Maya. I'm from Baltimore, Maryland. I graduated from North Carolina A&T State University. And my fun fact is that I got to teach nuns about calcium during my rotation.
My name is Lauren. I graduated from Penn State. I'm from between Allentown and Philly, Lansdale. And my fun fact is I was at Southwestern Veterans Center, which is a long-term care facility for veterans on Veterans Day. So that was an awesome experience to be able to be around the veterans and talk to them and just say thank you.
My name is Laura, and I'm from the Pittsburgh area. I graduated from Kent State University. And a fun fact is I met a patient with a blood sugar of 1,500. Wow. And he was our age.
My name is Jody. I graduated from IUP, and I'm from Beaver. And my fun fact is that I survived my clinicals.
Hi, I'm Maria. I went to Penn State. And then I am from between the Altoona and Evansburg area. And my fun fact is I love testing for hemoglobins at WIC.
Hi, I'm Leah. I'm from the Pittsburgh area. I also graduated from Penn State, and my fun fact is that I got to go to a food vendor show, and I got a bunch of free samples, and it was awesome.
I'm Elena Leteri. I'm also from Pittsburgh, the Mars area. I went to Penn State also, and my fun fact is that during my Southwestern Veterans Center rotation, we would have funnel cake Fridays and make funnel cakes.
Hello, I'm Jane Pelotis. I'm from Cleveland, Ohio. I graduated from the University of Akron. My fun fact is, you guys took a lot of good ones. Probably not a fun fact, but I hit a deer a couple weekends ago, and it's pretty expensive, let me tell you. So avoid that.
Maybe not fun, but unfortunately
Yes.
a reality.
What happens? Yeah.
My name is Sam Scuchetti. I'm from Cranberry Township in Pittsburgh. I went to Pitt, and my fun fact is that at Southwestern Veterans Center we got free ice cream every Thursday. That's a lot of food.
Okay, well, you'll get to hear more from our interns a little bit later in the presentation, but if you'd all like to have a seat, thank you for sharing with us. Okay, so this is the open house for our internship. Our internship has been around for 25 years. This class that you just met, they will be our 25th graduating class. We take 12 interns a year, with the class of 2012, 2014, we had 100% pass rate. Because I know that's high in everybody's questions. So we are a little bit different internship than most, and that's what I'm going to sort of share with you today. This internship, we say is in Pittsburgh. For many of you that are from the area, we're about 25 minutes from Pittsburgh. Our main office for our organization, Adagio Health, is in downtown Pittsburgh, right across from the convention center, if you're familiar with the area. Many of your rotations with this internship will some will be downtown, some will be in the surrounding areas, in the surrounding counties. So you need to definitely have a car. And you're going to be doing a lot of driving. And a GPS is sometimes helpful. And you have to deal with the winters. You have to allow plenty time for, construction. And you have to watch out for the deer. So, but in general, we used to have this internship based out of downtown Pittsburgh. And our office there, I'm going to say 6 or 7 years ago, we moved it out to this office because we finally had the facility here to do that, but also it just got so costly for parking for our interns and having to come in and out of the office. So this is just a little bit easier. You're right on 28, and you can go in a variety of different directions. To share a little bit about how many of you have been on our website, Adagio Health's website. I would think most of you. Adagio Health, our main focus is to provide women's health care and education services to women and their families, and we do so in a variety of counties. We have a 23 county service area. So we go up north to Erie, down south to Fayette, over to the east to Indiana, and then over to the west to Ohio. Our services vary in each of those counties depending on need, but in general, our core business started back in the 70s, and it was women's health care, and specifically dealing with reproductive health. So in about 1979, 1980, the Adagio Health staff recognized that there was a nutrition program that was starting, and they bid on a couple of the contracts, and that is the WIC program. How many know the WIC program? You know the WIC program? Okay, one of the biggest employers of nutritionists and dietitians in the country. And so that is when the focus on nutrition started. I came on board and we ran the nutrition services, the WIC program, and then we have it in 5 counties: Armstrong, Beaver, Butler, Indiana, and Lawrence counties. So when you do a WIC rotation with us, you'll be assigned to one of those locations. And then at that point, I was not director of the department. I was what they called a field supervisor, but I was having problems finding registered dietitians. So that is when we decided to create an internship, so we started that process. It took us a while to do that, but our first graduating class, I believe, was in 1991, and that was like 5 students, or 5 interns. And so we had the internship, and then later on, I'm going to say, I don't know, in maybe 2000 or so, and don't quote me on these dates, but then there was another opportunity. And with the SNAP Ed program. Now you all know SNAP, food stamps. Well, they started an education division. And so we did some applying for some of those grants, and we created what we know, or what we call our Power Up program. And we are probably in about 10 to 12 counties providing that service. And we provide services to preschool, school-age adults and seniors. We go in and do programming to promote healthy lifestyles, which include nutrition and increased activity, to probably about 30 to 35 school districts in our service area. But then we also have a lot of other community partners like senior centers, YMCAs, and so we have a pretty large staff providing those services. And then the last piece that's part of the division of our nutrition division is we have a nutrition counseling division that we have our dietitians that we contract out to organizations. It could be the food bank, it could be the HIV clinic. We have contracts with jails, we have contracts with federally qualified health clinics. We provide services, nutrition counseling services in our own offices to our medical patients, as well as to just people that will find us and want nutrition counseling. And that is something that we're working on currently expanding. So all in all, that's what the nutrition side of Adagio Health is involved with. We have about 25 registered dietitians on staff, and there is about 90 FTEs in our department in terms of support staff. So there's always a lot of change and a lot of opportunity at the same time. And to share a little bit about our internship, well, first of all, as the director of the program, I do have my master's. I am a registered dietitian. I'm also a fellow of the academy, and I also am a site reviewer for And what that means is I go across the country and accredit dietetic internships. And over the years, it has allowed me to see good things and see what doesn't work. And I'd like to think that our internship is really strong and one of the best in the country, because I have no problem taking ideas and bringing them back and changing things. And and I think that has been a strength of our internship, as well as we get input from our graduates, and what the internship looks like today and what I'm going to talk about today, I will say it will be very similar next year, but it will be changed due to sites that we are rotating through and changes there, but due to trends that maybe are changing in healthcare, and that we need to help you prepare so that we are helping you focus in the new roles that are coming forward in nutrition. I also am a very strong supporter of working and giving back to our professional organization and the Academy of Nutrition and Dietetics, both locally, state level, and nationally. Over the years, I've had positions on basically all levels. I've been past president of the local association as well as the state dietetic association. In fact, I was president when finally licensure went through. So, we also try to really promote that you have to support your organization. You have to become involved and understand what's happening on the legislative side, because that's what really is making the difference of how we get reimbursed for our services. So this is all a part of what we try to instill as you were here for the internship, as well as we like to show you a lot of different opportunities that you probably don't realize exist for dietitians. And you'll learn a little bit about that in a minute. This internship is what you make of it. We have, we have a network of professionals that are on our advisory board. Some of them are, again, nationally known in their field, and they help us kind of operate the internship in the sense of helping us maintain the sites and maintain the quality. But at the same time, many of them act as mentors, and each intern is assigned a mentor. And it's a nice opportunity. Number one, they're kind of there to support you. You have to meet with them monthly. They will maybe take you out to lunch, take you out to dinner. If you're not from the area, it's just kind of a nice, contact to have. But then they can also help you make connections, and that's, I think, a real plus with our internship. Okay. I already talked about our downtown office, and this is our, obviously our Natrona Heights office, where you're at. This is where you are based out of. You will, on an average, probably only maybe be here once every 2 weeks or so, sometimes more than others. But most of the time you're going to be out in your rotation sites. Now, as you all know, a few years back, the Academy decided that every internship had to have a focus. It couldn't just be all general. And we decided to make our focus more of a business focus. And so we like to promote entrepreneurial skills and how you use them practicing in the community. And one of the major ways we do that is there is a marketing project. And it pretty much starts at the beginning of the internship and goes through till maybe 6 to 7 months. And you actually get an opportunity to do some sort of testing to see and some questioning about what the problems are, and then decide on what you want to do as an intervention, and then you actually get to do it. Now last year we did a project on our nutrition counseling expansion, and the interns in that year were heavily involved in helping us expand our nutrition counseling division. This year we focused on the WIC program and how to retain our current clients or patients. And I mean, yes, those are two very different kind of venues, if you will have it, but the concepts are still the same. And no matter where you go as a dietitian, you always have to market yourself. Even if you are a clinical dietitian, you have to continually promote yourself, whether to the physicians, to the administration. You have to continue to market yourself if you're in private practice. In any place that you would practice or work, you are going to have to continue to promote. And so marketing skills are key in my eyes, no matter what you do. And the business side of it is very important too, because unfortunately where we are in the world right now, everything's about the bottom line. And you need to kind of keep that there and equate it to, I got to keep the bottom line in mind. I got to, share numbers with administration. I got to, you got to manage all those things. It's just not that you go and you counsel patients. That's not where things are anymore. You've also got to kind of cover the other side, no matter what kind of dietitian or where you're practicing. So I try to instill that or keep that thought, because my goal is to help our graduates be leaders, as well as leaders in the field, as well as to help dietitians' roles grow. And but everybody has to help do that. We can't just do it ourselves. I mean, when I came on board as the director, there were 2 registered dietitians here, and now we're up to 25. So, but I've had a lot of help to do that. But, so, anyway, we're going to move on to some of the more logistics. Keep in mind, we have an early application deadline than everybody else. Our application deadline is due January 8th. And the reason that we do that is because of the way this internship is set up. I feel very strongly that we want to have time to interview the candidates that we are interested in, and that you also have an opportunity to meet us individually, more so than just here. So that is why we do that. It makes it a little bit crazy, but I've also heard that it helps everybody get everything ready, and then they're ready to apply to everybody else too. So you need to keep in mind that you still have to submit the application online to DICAS, and we're also going to ask you to upload a current resume, and there's an addendum for us to the DICAS portal. Make sure, I mean, this is just in general, that you would register with D&D, and then you have to make your selections by February 15th. Because it doesn't matter. We want you, you want us, and you're not on that. If you don't do that part, it doesn't, it won't go into the equation and into the program. Okay. Now, I started to say a little bit is different about our internship. Many internships you go to one facility, like a hospital, and you do all of your rotations there. Maybe you go out and do a little bit of clinical, maybe with, community with WIC, and maybe you go somewhere else and you know, do, I don't know, something else with maybe Head Start or something. Here at the Adagio Health internship, what we do is you're going to be rotating, and again, this is just what it is now. It will vary next year, but you're going to rotate through approximately 14 different facilities. Some may be only 1 week, others may be as many as 8 weeks, like your clinical. So what makes it, I think, hard, and why this internship isn't maybe for everyone, is that you have to be comfortable going to a new site, introducing yourself, getting to know the lay of the land, getting to know what the expectations are, and once you're just starting to feel really good and you think, boy, I can do this job, you're going to leave and go to another rotation and start over, okay? And so you have to feel comfortable with that. Most of the rotations, you are there by yourself, meaning you are not with a fellow intern. There's a few exceptions to that, but you're going to be there by yourself. So you have to be comfortable. You know, you're going to be driving to the facility, finding it, meeting everybody, and pretty much being on your own. We are certainly here to support you during the orientation. Usually it's 3 weeks at the beginning of the year and starting in August. And we give you everything that you need to know about the internship. You will have the manual that outlines everything. You will have a list of all of your projects. You will have your rotation schedule. You know, you will be assigned your mentor. You'll have everything. So we have it well mapped out after these last 25 years. But the thing is that this internship is what you make of it. If you want to just come and do the minimum, that's up to you. But there's a lot of opportunities outside. There's a lot of exposure through our board members and through our sites to do other things to really get comfortable with the field of nutrition. And one thing, if you are uncomfortable speaking in front of a group, and maybe even impromptu speaking, by the end of this internship, you will feel very comfortable doing so. That is something that is just, you get a lot of opportunities, and I'm sure our current class will tell you just in the few months that they've been here that they have really had the opportunity to do this a lot, and though they may not be totally comfortable yet, they're getting better at feeling comfortable. And that's kind of another strength, strength of the internship. You do need to have a car. You need to live somewhere in the area. I don't get too concerned about where you live. Sometimes many of you might be wanting to come to this internship because you have family in the area and you're going to live with them. Some may, want to live like in Greensburg, which is a little bit of a drive. But again, if you can make it work, that's fine with me. But the minute that you're late for rotations or there's some kind of issue, then we're going to have a talk and we're going to have to find a different solution. I once had, this was several years back, but I once had one of our interns actually drive from Ohio every day. And he made it work, and I'm not sure anybody else could have done that like he did. But again, if you can make it work, without incident, that's fine. For those of you that don't have any ties, once the class is finalized, we get our the matching of who we've matched with. Then we ask everybody's permission. We send out the list to the class, and then you can work on living arrangements. The only thing that I would say is that we do not want more than 3 people living together in one facility or one house, apartment, whatever. The history there is, years ago, we had 5 women living together in one probably too small house. And it was one of the hardest years of the internship that I ever went through because they ended up not talking to each other. And when you have half your class pretty much not talking to each other, it wasn't good. So we try to monitor that. Okay, so the other way that we are different in that maybe when you're evaluating some of the other programs that you're looking at, they'll say, oh, you're going to do your clinical here, and you're going to do 10 weeks. And then you're going to do food service management, and you're going to do 12 weeks, and then you're going to do whatever, community, and the others. Well, we don't take that approach here. Though there is a focus, when you work as a dietitian, and I'll use myself as my job, I don't say, okay, today I'm going to work on management stuff. Next week I'll work on food service. My days are all blended, and that is true of everyone's roles. I really would find it pretty hard to believe that anybody does separate it out. So when you go to a rotation, it's going to have a main focus. Obviously, when you go to your hospital, that is going to be mainly clinical, but you're going to be involved with doing some community and maybe even some food service because it's all linked. Okay, so we choose to look at it in that sort of stage, that they're not separated. So we separate our rotations out into those 5 on the left, but each one has the components going across the top. Okay? Okay, so to talk a little bit about food service management, currently where you would get to have experience, we focus on some school districts, and currently we're using Quaker Valley, Leechburg, and Montauk school districts, that you will be with registered dietitians there. Schools are just finally starting to really look at wanting registered dietitians instead of just a food service manager or supervisor. So I think that's a great opportunity for growth for dietitians, and it's much needed. It's really being seen as needed because of the obesity issues that we are dealing with and the food that is being served. The other place which you heard the interns talk about is Southwest Veterans. They actually have kind of a 2-fold rotation, one of which is that you're going to focus mainly on the food service side of things and see how that operation runs. You also you'll spend one day with the Allegheny County Health Department, the Food Safety Division. And to me, this is one of the most fun things. And because you get to be on the other side. You get to go in and see what the inspectors do. Because most of the time in your job, you'll be on the other side. And you know, what I always tell the interns is when they are reporting out to me at the seminar, make sure you tell me what restaurants or what facilities that you went to so that we know whether we should eat at them or not. Okay, so then we're going to go on to the nutrition, education, and public health. I mentioned to you about Power Up. This is our, as I said, it is funded through USDA and SNAP Ed, and you know, we have a fairly large program, and you will rotate through the Power Up program. Again, the location may vary, not every intern will be at the same, but we put you, or identify a site that will be where you are going. And these are some of the places where we have programming, and actually we just got approval, actually no, they're all on there now, Sharon is on there. Okay. So those are all the school districts that we're currently in. Some of you may have graduated from some of those. And this is just Power Up in action. Another rotation that we have is Giant Eagle. Many of you, again, probably recognize this as one of our major grocery chains here in Western Pennsylvania. And they have dietitians on staff, and our interns work with them. Sometimes it's you know, doing store tours, sometimes it's maybe going to public speaking events, sometimes they are doing some nutrition counseling out of the stores. And so it's another venue. It has been growing within the last few years. There are a lot of the grocery chains across the United States have registered dietitians. And so if you haven't thought about that, that is possibly an opportunity. You heard me talk about WIC, and you all know, Women, Infants, and Children's Program, and you would be rotating through one of our offices. It's currently a 5-week rotation, and the last week you do basically staff relief, where you are the manager, or as much as you can be the manager of the program. And then we also have you spend a few days with the Allegheny County Health Department WIC program, so that you can see how a program that is a federal program that is administered through the state health department with various contractors, us being one, Allegheny County Health Department being one, and how the services, like the rules are all the same, but how the services can differ. And we want to do a share and compare, and that's what we'll talk about in seminar. This is something new that we were able to add this year, and it's the Birmingham Free Clinic. It's on the south side of Pittsburgh, and you get to go there and basically talk to some of the patients' clients that are there. And it's sort of an interesting opportunity. You know, one thing that we really try to also focus on with this internship is that, you know, you can't make assumptions about patients when you're seeing them. They may or may not have the needs when they're if you're seeing them in the hospital, to do what you're saying. This is one way. I mean, you need to always be cognizant of not everybody always has everything at their hands, that you may be saying, oh, try this low sodium, blah, blah, blah. Well, they may not have that opportunity, and sometimes they're too ashamed to tell you that. So we're just trying to help you be a little bit more in tune, because you're going to end up possibly serving patients of all kinds. Okay, then we go to medical nutrition therapy. The clinical, these are currently the rotation sites that we are using. They're all great hospitals. They all kind of have a little bit different focus, but that's kind of what's great about it, because then we come back and we hear about them in seminar, and everyone shares a little bit about what's going on. But generally speaking of those, there's probably only a few interns that have completed their rotations thus far at their hospital rotation, but I think, you know, their confidence has been really boosted in terms of application, because it's one thing to read it in a book, it's another when you're trying to actually apply it, and there's 4 or 5 things going on with that one patient. You'll also do some a rotation in long-term care and Presbyterian senior care and Villa St. Joseph. You'll go to one or the other. Everybody goes to Southwest Veterans and does actually kind of a clinical focus. And then the UPMC of visiting nurses, I'm not going to say that it's really long-term care as much as it is that you will go with a dietitian that her car is her office, and she visits patients in their home. And it's truly the best way to really know what resources people have and what they're really doing. And many times you may go into the home and you may not even get to talk to them about what you wanted to talk to them about. It might just be initially building rapport and helping them get through whatever they need to get through because they just came home from the hospital or whatever. But that's also a very interesting thing, and I think that as affordable care moves forward, that's where you're going to see more of the jobs go in either home health or support on the phone, because the hospitals are not keeping patients, the insurance companies are not allowing them to be kept, and so the role of the dietitian in support after the patient is home is, I think, going to be a real growth, and I think we're going to see some of the numbers decline in clinical dietitians at hospitals. Just a prognostication, and it may take some time for that to happen, but if things continue the way they are, that's where it's going to go. Okay. So, I am now going to pull up the next portion, and I'm going to ask our interns to come on up, and they're going to talk to you about the next section.
Okay, so we are going to talk about the didactics portion of the internship. The first thing that I'm going to talk about is orientation. It lasts 3 weeks, so you'll come to the office for a good majority of those 3 weeks, but then you also go out and visit other sites too. But basically, with orientation, you learn about all the different services that Adagio Health offers in more depth than what Karen went over today with all of you here, because you're going to be representing this company. Even though you're not technically working for the company, you're still going to be representing it for the next coming year, so you want to make sure you understand it if someone should ask you a question. We did HIPAA training, we had a bunch of talks on professional behavior and ethics, which I thought was really informative, and I look back on that and I use parts of that throughout my rotations too in certain ways. We also had a seminar on the nutrition care process and a bunch of clinical seminars with Linda. She's not here, but she teaches us all of our clinical seminars, which they'll talk about. So it's just really good because we all come from different colleges. I mean, some of them come from colleges together, but we all learn different things. So doing these seminars and having these talks kind of puts us all on the same ground level, and we're all on the same level, so we can go forward.
And then we also did a HEMA-Q training. And this is where we learned how to finger stick people, because you'll be doing that for 5 weeks at your WIC rotation, and it's kind of scary at first, but it oddly becomes fun sticking people. It's like a challenge when you're in your WIC rotation, especially when they're not for it. But so we did learn to do that on each other. We also did blood glucose testing. Jess had the insulin pump inserted into her. So, I mean, orientation was really fun for those 3 weeks. It was a little bit scary, I'm not gonna lie, but you got to know all of the interns because you're going to be doing this together for the next however many months, so you wanna know everyone and be friends. So, I look back on orientation and I'm glad that we had it, because it was helpful and informative and you got to know everyone, so.
Okay. So the scavenger hunt is another part of orientation. So orientation is kind of overwhelming when you first start. You get a lot of information thrown at you. So the scavenger hunt comes at a really good time. It's a day where you get to just kind of explore the city of Pittsburgh. So if you're not from the area, you get a good understanding of where certain things are laid out, which will really help you when you go to your rotation sites and things like that. It's also a really good opportunity to bond with the other interns. It's your first time out together. You get to know each other on a more of a personal level. So here are just a few pictures of the things we saw. You get to actually see one of your rotation sites, the Presbyterian Senior Care, so if you have that, you'll know where it's located. Here's a bunch of us doing things in the Strip District, going on the T, and then you ended at Mount Washington. And there's us. All right.
All right, and you do get to go on various field trips. So this year we had the opportunity of going to the Greater Pittsburgh Community Food Bank, and we met with the chef there, Chef Jesse, and he kind of gave us like a rundown, like kind of like a class setting of, you know, the background of what they do there and his job there, and was really informative and gave us out menus and just various things that he's worked on. We even got to help package up some of the items and send them on for packaging to be distributed. And then we got to go to a event called Hot Pink. It was a fundraising event through Adagio Health at Heinz Field, and it was really cool. We all worked various stations there. The theme was called Dessert First, so there were a bunch of different stations of desserts, and we got to go through and you tried all the different things, and then you got to vote on what your favorite one was. And there were hors d'oeuvres and DJ, and it was really cool. There's some pictures. So obviously the pink lighting everywhere and the really cool like cookies and everything. It was really good.
So I'm going to talk about professional meetings. During your internship, you're required to do at least 2. You can do more. They have to be clinically based, and it's just a perfect opportunity for networking with fellow RDs and future RDs. So currently we haven't been to one yet, but we're, because usually they're during our night classes or we're busy or whatnot, but we try and look for the free ones because we are kind of poor and don't work. And we also look for the ones that have free food, so that's always a plus.
Alright, so all interns are required to complete 8 hours of community service with a community registered dietitian. And for these hours, we go to different events with dietitians from Giant Eagle a lot of times. So for mine, I went to Cleveland's Convention Center, and it was a health expo where we promoted the dietitians, participated in food demonstrations, and also interacted with all the visitors there. And these hours are important because they help us enhance and develop our marketing and presentation skills. And then we also have to do 4 hours at a community feeding site. So we all did that really early in the internship, and we all went to Jubilee Soup Kitchen. And this experience exposes to a different population that we might work with in the future as a dietitian. And this is
So we don't always have the time or opportunities to visit all the different sites that dietitians work at. So one of the things that we do is Karen sets up like a meeting, usually here with food, which is always good, and we invite all of the other internships around Pittsburgh, so like Seton Hill, Pitt, IUP, and CCAC. And we talk about the different things that dietitians might be a part of out in the field, and that way we can all get the information without having to spend the time or find someone to go out and look at for the day. So we learn things like coding and billing if you want to open your own practice. We talked about the code of ethics and so like a bunch of different things like that. And some of you, at least from Pitt, you might recognize some of these different people that came to speak with us, and it's just a good opportunity to network with your peers and other people in internships and meet new people and learn about new things. And there's everybody that met together and
Okay. So this is an entrepreneurial business-focused internship. So the marketing project is a pretty big deal. It's throughout basically the whole internship. And we get really great real-world experience of working with the supervisor and not only making up your own marketing plan, but then implementing it and see if it worked and see if they could actually carry it on after we're gone. So it's pretty fun to see, to come up with ideas and then work with your supervisors.
Alright, so we have clinical seminars. First type of seminar would be like visiting a facility and meeting different experts out in the field. So this year we went to a burn unit at UPMC Mercy, and then we also went to like a dialysis center, and there's more to come. These are just pictures of us. Oh, and then we also have clinical seminars here where we are with Linda Evans, and we kind of go more in depth into like MNT and learning different diseases and conditions, and we get to hone in on our presentation skills, and we present different topics.
So we do have monthly seminars. Now these are different from the clinical seminars. This is where we all get together. It's usually after our rotations, and we are with Karen. And sometimes she brings us food, like I said before, which is great. And then we discuss our rotations, and sometimes she gives us topics to discuss, just like with staffing and ethics and things like that. And then we do celebrate our birthdays here. So this happens at seminars with Karen, and we usually just either have a cake for all the birthdays that month, so it's pretty fun.
So the Cultural Food Seminar is kind of our holiday party. It happens mid-December, and each of the interns gets to pick their own country, and then you research and present to everyone, and you cook a special dish from the country. And it also counts as continuing education credits, so we invite a bunch of the dietitians that Adagio works with to come, so it's a fun event.
Okay, so we got a variety of different rotations, but we have days where you can kind of pick what you want to do. For example, I want more background in maybe cancer. We have one seminar, but I want to do a specialty site in cancer, so I'm going to find someone who could possibly let me shadow them, do some either research or counseling with some cancer patients. So I'm going to use that for my specialty site. Just what do you want more information in, and kind of go from there with that. And we have a mentoring program. As Karen said before, you're matched with a mentor during orientation, and it's really just someone you can talk to, get advice, go to professional meetings with if they are going. I'm not from the area, so my mentor was a huge help in getting the lay of the land and restaurants, because we always go out to eat. So I learned a lot of really good restaurants around the area from my mentor. They're just really helpful. I've reached out to her for presentations if I needed more information about certain diseases or machinery or anatomy, physiology. They've been in the field of dietetics for a while. They've been mentors for a while. I know mine has, I think, since maybe the beginning. So she knows a lot, and they're just really helpful.
Okay, last but not least, we'll talk about intern fun. So your internship will not be all work. So you do get, time to spend with the other interns. We've celebrated engagements with Natalie and Emily. We've celebrated birthdays outside of the internship. So it's going to be some fun. You're going to meet people, and the 12 people that come together for this next round, you guys are going to be a family. So don't think it's all work. You'll depend on each other. You'll work with each other, but you'll also have a lot of fun.
And to add to that, I also think that it's also a learning opportunity. We have interns with a large class of 12. We have the opportunity to learn from each other because everybody has different backgrounds, sometimes come from different areas, and it's a huge learning opportunity in that respect too. So there's learning occurring on a variety of different levels. Okay. Okay. And one thing that I forgot to mention, all of the rotations sites, all of the mentors, all of our advisory board members, they are all volunteering. They are not being, paid by any means. They are doing this because they are committed to the profession, to training new and young professionals. Quite honestly, if we had to, and it's like this with most internships, if we had to pay everybody that was involved, I mean, tuition would be, $90,000 or something. I mean, it would just be ridiculous. But here, especially in Pittsburgh, I think we have a strong network of nutrition professionals, ones that really care about the program, the field of dietetics, and about our interns, and then ultimately our graduates. One plus of this internship is when you are done, you end up with a huge network that will help you in the future. And that doesn't always occur with many of the internships. The other thing that, when you do those specialty sites, we try to work those and have some maybe more towards the end of your program, because many times they can turn into a job. In the last 2 years, we've had 2 or 3 graduates that they did their rotation or their specialty site, and it allowed them to make some connections that actually did land them their first position. So where I was going with this all about graduation is, graduation for us is a celebration with everybody that is involved with the internship. So that brings site supervisors, mentors, board members, Adagio Health staff, and the interns' family and friends, the graduates' family and friends. So graduation is usually a pretty big event. We usually have about 100 people that attend. And the other piece that we have is we have an award. It's a leadership award. It's named after a woman, Dorothy Kolodner. She was chief of Allegheny County Health Department many years ago, and they had a very innovative nutrition program. They were using computers and doing a lot of things before most of us didn't even know what a computer was. And she had a lot of foresight. She was a graduate of Carnegie Tech, now Carnegie Mellon. And she actually brought the WIC program to Pennsylvania. She had enough foresight to write the grant and brought it to Allegheny County, and she actually wrote the first WIC checks in Pennsylvania. So she has since passed, and in her honor, the board and her staff set up a leadership award. We have everyone at the end of close to the end of the year, meaning the board members, the site supervisors, and the interns themselves vote for somebody to receive the leadership award. And this was one of the recipients. Back on our wall there, we have the recipients over the years. And actually, you may have seen Jessica running around here today. She's actually she's actually now on staff. She went and worked somewhere else, and then she came back here, and she's now our Nutrition Services Operation Manager. So, but anyway, we have the Leadership Award, and that's something else that is unique to this internship. And this is just some graduates over the years. I will say that when you come to this internship, generally speaking, when we take the initial picture at orientation, and we take one at graduation, hair color and hairstyles usually don't change majorly. But and they were all in different settings depending on what has happened over the years, but just thought it's always a nice remembrance. Okay, so as part of this internship, you also have the opportunity to go on exciting adventures. And sometimes you don't know that they're going to be exciting until you get there. You also try to have some fun and always make new friends. And remember that we have an early application deadline of January 8th, and that is when interviews will be conducted. And make sure you look at diecast, and again, go back to our website if you need to. And now I will take any questions that you have. Don't be shy. Yes?
The $75 application fee that is to Adagio Health, can that be paid online, or do we have to mail a check?
I think you have to mail a check. Yeah, it makes it too complicated to try to do it between diecast and
Okay.
Yes?
As far as recency of education goes, like how do you determine how competitive someone is versus, I know, is there a number of years that you cut it off? Is it 5 years or is it less?
Well, as long as you have a verification statement that says that you are meeting the requirements, that is really predetermined before you come to me. I mean, if you have the verification statement and somebody has verified that you meet the recency of education, then.
Would you, let's say someone graduated 3 years ago versus someone who just graduated, would you weigh one of the others as being better or worse?
Not necessarily. The one thing that you bring up a good point, the one thing that I want to say is because our internship is so different, I mean, I'm looking for individuals that are well-rounded, that are comfortable with, in a variety of different settings, meeting new people, being comfortable being on their own. So, just because somebody has maybe a 4.0, but they don't like to talk to people, that may not work real well in this internship. So that is another reason why I feel very strongly about, we'll do a paper screening of your application, but we feel very strongly we want to meet you. And you'll be, possibly interviewing with myself and at least 2 of our board members, so advisory board members, so that we can get to know you and you get to know us. Because we want it to work, and we want everybody to feel comfortable, and we try to tell you everything, about the internship that we can. I mean, you need to be very flexible. That's something else that I didn't mention. We give you real life experiences, and as the interns here thus far have experienced, stuff happens, things change, and we try to make the best of it. And sometimes you can learn the most from an experience that has gone bad. So, and that's what we try to say. You learn from every experience. Sometimes you learn the best practices. Sometimes you learn the worst practices and not what to do. So, flexibility is key, but at the same time, those are all traits that I look for as we are interviewing.
Is the question, I'm sorry, is the interviews usually in person or is it usually Skype or?
If you are within 2 to 3 hours, we expect you to be here in person.
Okay.
But we've had interns, from across the country, and we will do Skype if we have to. But if you are nearby, we really prefer that you come in person.
Thank you.
As far as commuting to the rotations goes, say if you're located in the Pittsburgh area, what's the furthest that you would have to travel?
I like to say it's like a 50-mile radius.
Okay.
I mean, generally speaking, if you live in sort of the kind of Oakmont area, that's kind of pretty central. We have one site that is on the border in Steubenville, Ohio. The furthest north we probably go is Katanning. We go as far west as Newcastle. We go as far south as Fayette. So, but the other thing is this, you may have one rotation, maybe you have to drive, I don't know, 2 hours, but it may only be a 2-week rotation. So you can live with it for 2 weeks. You know, because they're always changing, it really kind of, you know, varies. And as someone said, they lived with someone while they were doing their WIC rotation in Butler County. And so sometimes people do stuff like that. But we feel very strongly that, you know, we want to make sure we have good rotation sites and committed rotation sites. And in order to do that, we have to cover that area. Plus the fact, you know, we also somewhat are competing with, you know, Pitt, IUP, Seton Hill, all of us. So all of the ones in the cities or close by kind of get saturated. And some probably don't even want to take interns. So.
For the 3 specialty areas, is that like a completely autonomous arrangement, or like do you have a list that?
No, I mean, what I generally do is I will start to meet with the interns, and we'll talk about, like, you have to explain to me what you have an interest in and why you want to do a rotation site, and then we'll kind of dig down and try to develop some things. I mean, over the years, you know, we've had people do some real unique things. You know, they were going on a maybe a vacation with their parents over holiday break, and one intern ended up doing going with the dietitian at the Olympic Center. I think it was skiing and skating, which was kind of interesting out in Colorado. You know, that's kind of more of a unique thing. You can go back and do them where you're living. If you're not from this area, I know I've talked to a few of our interns currently. You know, we're going to try to set something up where they live so they can start making, you know, building some relationships and networks. You know, you kind of have to, sometimes you just have to sort of we talk about what the interests are, and then we try to, you know, kind of make it work. So no, I don't have a list. It's not meant to be kind of cookie cutter. It's meant to be more of a unique experience. And many times, like I said, they do turn into jobs. So, you all have more questions than that. I didn't do that good of a job. Maybe the interns did a better job of explaining. Yes?
I was here last year and you talked about the RD exam prep class. Is that something you still do?
Yes, I'm glad you mentioned that. We left that off the slide. We feel very strongly, again, our whole goal in being here is to pass the RD exam. And so we do an online prep course that will start in April, and that's initially to get you started to understand what the testing format will be like. And then right after graduation, again, that group of schools, the Dietetic Educator Seminar Group, sponsors Jean Inman to come to Pittsburgh to do a review course. And I feel very, very strongly that going to the in-person review course really helps the pass rate. And what we have in place is we generally have a fundraiser, and depending on the funds that come from that, we try to help offset the cost of the Jean Inman course. And what we've done in the past is, so you register for the course, you take it, and then once you take your exam, you can give us the receipt and we will pay a certain portion of that depending on the amount of money that has been raised. And the reason that we do that is you have to take the exam, I forget the date we have in the manual, by November something. Because what we find is, if you don't take the exam soon, you lose the information. Because you have to know all this information. And then if you start working on a job and you're focused on, I don't know, clinical or diabetes, well then everything else gets a little bit cloudy because you're not using it. And so at first I really encourage you, if you feel prepared, to take the exam almost immediately when you become eligible. But we try to encourage you to not wait to take it, because it's very easy to push it off and say, oh, I'll take it later. And this is the incentive. Because, and many of you may or may not know this, but up until, I don't know, 5-6 years ago, maybe it's been longer, you could only take the exam in November. There was one day in November and there was one day in April. And you had to wait and take it then. Then when they changed it to, you can go to a testing center and you can take it basically whenever you can get it scheduled, we had a 100% pass rate up until that point, after, 15 years of this internship. When that happened, our pass rate went down. Because we had people that didn't take it for maybe a year. And then because they hadn't used it, they lost it. And so that is when our advisory board said, we got to do something here because we have to have a better pass rate. And so that's when they came up with this sort of incentive. So if you take it by this date, then you'll get, some money back on your review course. So, words of wisdom, try to be prepared, take the test as soon as you feel prepared, but as quickly as you can once you become eligible. Because it's a lot of information you need to know. I don't know that I could pass the test these days. Because, I'm so focused anymore, on budgets and everything else that it would be tough. Other questions? Mm-hmm.
When you're overlooking someone's application, how would you rank the components, like personal statement, work experience, volunteer experience? Like, what's something that you look to that stands out?
I can't say that I rank those individually.
Mm-hmm.
I score all of those and give points for everything. I certainly read the personal statements and I try to look at something that that has a little bit is a little bit more broad and a little bit more personalized, I guess. But I look heavily at work experience, volunteer experience, whether it's in the field or not, put it down. Because to me, maybe you worked at a shoe store while you were in college and you think, oh, what does that have to do with anything? But you know what? It shows that you were responsible. It shows that you maybe managed to go to school, go to work, and do all those things. So it shows that you can handle a variety of different things. Another thing that I didn't cover is that this internship is what you make of it. My expectations are that you're going to give 150%. There are minimum hours that you need to put in, but my expectation is that you're going to put in more than you have to. What I say to the sites and to all of you when you'd be here at orientation is our rotations begin at 12:01 a.m. on Sunday and end at 11:59 p.m. on Saturday. So the site supervisor can have you be in those rotations at any time. Now generally they will tell you ahead, excuse me, and you will know that, and most of the time, probably 85% of the time, they will, you're not going to be doing things, generally on weekends and stuff, but there are those that do. There may be, somebody that's involved in union negotiations and they may want you to be there. We've had times when some group has been doing a commercial and they had to be in the grocery store at 2 a.m. Taping on a Saturday night because that's when nobody was in the store. So things like that are going to happen, and your rotations come first. And you cannot reschedule them. You need to make that your priority. This internship needs to be your priority. And again, it's what you make of it. If you wanna just come and do the minimum, you may get through the internship, but my guess is that you're gonna have a hard time, passing the exam. But if you take advantage and act like a sponge from all the site supervisors and the mentors, you're gonna be one strong dietitian when you get out of here. So, you have to be self-motivated, you have to be flexible, and you have to have a lot of drive. And organization is key with this internship, because at orientation, you're gonna have your schedules for your rotations, but you're gonna have 3 or 4 projects happening at one time, and you have to manage your time and meet your deadline. We also didn't talk about this, but we also have team leaders, and each intern gets to be part of a 2-team group that they manage activities for the internship and special events. So when we did Hot Pink, there were 2 interns that kind of managed that, worked with the person in charge, worked with the interns to make sure everybody had jobs going on. Today, the 2 team leaders put together the PowerPoint presentation, and then they helped organize. I mean, it may not seem like it, but there's a lot that goes into putting even this open house together. Making sure, we have food, making sure we have the handouts, making sure parking works, and somebody's managing that. When we do cultural foods here next month, 2 interns are managing that. So you also have to, that's just like another activity that you need to manage while you're doing your rotations, while you're studying for your exam with Linda, while you're reading her articles, and while you're doing something else for me. So, I think if you ask the interns, probably what surprised them the most about this internship is they didn't realize how many extra hours they were going to put in. They thought that they were just going to be coming to rotations, maybe having a class here and there, because the classes are, usually one of the evenings during the week. And it's more than just the rotations. There's a didactic component that takes up a lot of your time, and you're going to have homework. Okay. It was a long-winded answer, but it made me think of some things I didn't mention. Other questions? Yes.
As far as references for diecasts, are you preferring people in the dietetic field, or are you interested in somebody who's been a manager of yours, or is
You know what, that's your choice. Who's going to give you the best recommendations? I think it can come from, anybody, but I think it really should be somebody that, I think the ones that weigh the most with me is somebody that I know that knows you more personally, not of one student of 100 that, they probably just changed the name in the letter or whatever. But the one thing, that I will say, and hopefully, your advisors and whatnot have shared this with you, but please, when you are asking people to write you recommendations, make sure you say, will you give me a good recommendation? Because I have had people that I've gotten recommendations, and believe me, it didn't help them. It actually, put them down a rung or 2. And, and even when our graduates are going out and looking for jobs and things, I say, please make sure, or, that you ask them, will you be a reference for me, and would you give me a good recommendation? And most people, if they, will say, you know what, I can't give you a good one because of blah, 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 what happened, so don't use me. And you need to ask. Don't take anything for granted.
Do recommendation letters need to specifically reference your dietetic skills, or could it also talk about professionalism?
Yeah. It can, again, at least from my standpoint, I can't speak for other programs and other internship directors, but from my perspective, I'm looking for a well-rounded person that, probably most important to me is that you have a passion about the profession, and that you want to, is that you're willing to put the work into it. Because it can all be great, but if you don't care about it and it's just like, oh, well, yeah, I'm just gonna do this and that, you know, then it's probably not gonna work out real well. So, that's one thing that I try to see if I can, as much as I can.
This is really like a more detailed component of her question. Like, let's say you're always around your supervisor all the time, so he kind of knows more about how you are. But like your manager, maybe has a better title, and he might have an overall view, but not really a personal view. You would say go for the supervisor? Okay.
In regards to like career opportunities, like after graduation, where do you see your interns like getting careers and like how
That's
many
another
months
good question
out,
that we
like,
didn't
should
cover.
they get?
It's been a while since we did we were keeping like a tally. I'm gonna say maybe we need to start doing that again. But at one point, about 70% of our graduates got jobs with somebody that was networking with. It was either a site of internships or some type of extension of that. And then what happened about that time, we stopped looking at it because it wasn't meaningful, because we were getting so many people from across the country. And so somebody from California wasn't really getting, wanted a job here, and our reach, though it's far, wasn't that far. So we stopped looking at that. But generally speaking, we do, because of the network that comes about, pretty much, if you want a job, you're probably going to find one. We have some graduates that, I don't, my parents are okay with it, or I'm married and I don't need to, or so I'm going to study for the exam and then go and look for a job. So, that can happen. But then going to your next question is, where do you get jobs? We have people everywhere. We obviously have them in WIC, we have them in dialysis units, we have them in clinical. I have 4 in the last 2 years, now 3 years say, that have started their own businesses. And I'd like to think it's because of the skills that we've given them. We have computer sales, we have pharmaceuticals, we have long-term care, WIC. I'm going to say pretty much if you look over the 250 plus graduates, that they're just about everywhere. And though we have, we had a community focus in the early years, I just think, we're all, no matter what, we're all preparing you to be general as dietitians. And it's kind of the direction that you want to go and the opportunities. And I think that because of the diverseness of the rotations that you go through, it really allows you to see and do a lot of different things that you may not know that exist. Other questions? Okay, going once, twice. Well, I thank you all for attending today. I hope that we answered many of your questions, and please feel free to have some refreshments and talk to our current interns and find out anything else that you would like to about the internship. And have a safe drive, and watch out for those deer, and happy Thanksgiving.